Oh. Bloodthirsty animatronics that move on their own, creepy hallways and jump scares, and a whole slew of injuries that make you go, wait, that's not compatible with life. Today, we're reacting to freaky medical scenes and insane injuries from Five Nights at Freddy's to the movie. Let's dive right in. Oh, almost there. Oh, she stabbed in the back, didn't she? Oh, multiple. 3 stab wounds to the back. 3 went in probably about 3 inches or 4 inches. Either side of the spine, right at the middle of the back. Lower part of the lung, maybe near your diaphragm, maybe part of your liver that you're gonna hit, and maybe kidney. Could hit your intestines, but those are the organs that you think about. Causes her to collapse. Did she hit a major blood vessel? Your aorta comes up and around and goes down the back side. You could also be bleeding out that way or into your lungs and have a collapsed lung. Oh! Risk of drowning. You can hold your breath for 2-3 minutes if you're in a calm, normal situation. If your heart rate is up, you're expending a lot of energy, you need to get oxygen to your tissues. You may only last 20-30 seconds before you feel like you need to take a breath. You inhale water into your lungs, you feel like you're drowning, and without the oxygen, your heart's going to stop and your brain is not going to function appropriately. Get out of the water. Just get out of the freaking water. That's so creepy. Oh my gosh. We're seeing a lot of red stuff. This water also doesn't look the cleanest. Open wounds definitely increase the risk of infection. If somebody comes to the hospital, open wounds, and been exposed to this type of environment, you may empirically treat somebody with antibiotics, especially if they're starting to show signs of illness.
I think this might be our best episode yet. What did you do?
Strangulation injury. You're getting compression on the front. Could compress the airway to where you're not getting air in and out. Not likely pushing down on the major blood vessels on either side. It needs to be more rounded versus straight across here. Oh. Hard to know what just fell to the floor. People will come to the emergency department with really bad crush injuries. You're not seeing the normal attachment of muscles or bones because they're kind of all in multiple pieces. We do see injuries like this, but not that often. If it's an extremity, if it's that destroyed, then it actually gets cut off. Oh, geez. Now step away. Nope. Broken glass. Luckily he's wearing eyewear, so he's actually protecting his eyes. But the glass can cause lacerations. Landing on the ground. As long as you're not landing to an arm that's stretched out, you'll probably be okay. We see people fall often onto their wrist trying to brace themselves and they cause a foosh. Oh my gosh. Just being held up by your head like that causes a significant amount of pressure to your head, to your ears, and pain. Oh gosh, squished and squeezed.
Nothing in there at all.
Skull crushing injuries. We've seen injuries where people get crush injuries in the industries relating to like heavy metals. If somebody's head gets crushed, the chances of survival are pretty darn low. We don't see the full extent, but you'd expect that the whole skull would be crushed and brain matter would be splattered. Oh, glowing eyes. Haven't seen that before, but when we do an eye exam, we're actually looking for a red light reflex. That's why you see in photos, old school flashes, where people's eyes would be red. It's just a classic red light reflex, which is normal. If it's not there, then you suspect that there's something else going on. Run. If watching sentient animatronics hunt people through dark hallways has your heart rate doing way too much right now, that's exactly why I created Chillax from my company Life Happens, designed to help calm racing thoughts when your nervous system is stuck in fight or flight mode. Find Chillax at lifehappens.com or on Amazon.
Are you okay?
Oh. We see car accidents all the time. We always ask, are you wearing your seatbelt? Did the airbags get deployed? Was there intrusion of the car into the main compartment? Were there broken windows? Did you hit your head? Oh, it's the worst. Hit the head on the steering wheel. Now we're worried about head injury, concussion, intracranial bleeding, cervical spine injury, a fracture, or spinal cord injury. Oh, geez. Slip and fall, you see the ankle go one direction. Common injuries that happen there is just a classic sprain. Sprains hurt. Typically, it's due to an inversion of the ankle, and so you rupture some of the ligaments that are on the lateral aspect of the ankle.
What exactly goes on inside of your head?
I've even seen people have simple falls like this have open, dislocated, fractured ankles where the bone's sticking out of the skin. What we'll end up doing there, give some sedatives, give some pain medicine, put the bone back in the skin, clean it out really well, and get an orthopedic surgeon to probably take you to the operating room. Using sound to treat an individual. We'll use it in the setting of maybe acute psychosis or agitation of an individual. We actually have areas in the emergency department, ones I work at, where you actually have a calm, quiet area. The lighting is a little bit different, and actually the sounds that are in there are a lot more calm. Kind of the same idea here. You're seeing a hook go around the front from like a human standpoint, blunt trauma to the airway. So you get concerned that there could be swelling of the airway. So what you'll end up getting a CT scan of somebody's neck to make sure that the airway is not closing in on itself. And if you intervene late, you may not be able to put a tube through that area because the tissue is so swollen. Whoa. Oh, crush injuries, somebody stepping on another person's head. I think we don't realize as humans the amount of damage that you can actually cause, and you can actually kill somebody that way. Fractured jaw, crush injury to your skull, which then can crush your brain or cause intracranial bleeding. You can, hurt somebody's neck so much that it swells up to occlude the airway. Whoa. Hemisection at the torso, down at the pelvis. Sometimes people are like,
oh, that's a survival injury.
Unlikely. You're gonna bleed out within seconds of the aorta, and the lower venous structures won't be sustainable unless you literally have somebody to stop the bleeding instantaneously. Or you're a robot. And a decapitation. I see these 6 blades I've seen with Five Nights at Freddy's that you put on the suit, you actually get stabbed in the lungs, and then you die by drowning in your own blood. Or you can have a hemopneumothorax, or you die because you've pulled so much blood into your lungs that you don't have enough into circulation.
Think you're going, Jack?
Clothesline.
Oh, and a clothesline!
Let me know in the comments who your favorite wrestler is. Blunt trauma to somebody's neck or upper thorax, they're probably fine. If somebody's having discomfort or difficulty swallowing, that's when you need to evaluate. A lot of times you don't need to evaluate somebody if they don't have symptoms. It's so interesting. You got these animatronics doing their own thing, causing massive chaos and injury and death to individuals. It is very interesting, very nerve-wracking, and scary. But if you guys love Five Nights at Freddy, let me know in the comments. And as always, definitely check out this playlist right here, binge watch everything, and please make sure, we need to grow this channel. Subscribe, turn on your bell notifications, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.